So I was born in this hospital once upon a time, and it looks a little different now. And then grew up in Lavaca, graduated from high school out there, and then went to Hendrix College in Conway for undergrad. Went to UAMS in Little Rock for med school, and then did my general surgery residency at Christiana Care in Delaware. My senior year of high school, I was applying to colleges and knew I wanted to do something with science, but I liked social science and physical science, and I like sociology, I like biochemistry, and to me the best way to combine those interests was to go into medicine. I liked the procedural aspects of medicine, so I looked into a bunch of different surgical specialties, ENT, urology, OBGYN, of course general surgery, and there were things that I didn't like about each of the other surgical specialties and just kind of kept falling back into general surgery. And part of that was the mentors that I had were mostly in the general surgery departments. But ultimately that's what I kept going back to because I enjoyed the breadth of the procedures, the breadth of the patients. You take care of elected healthy patients, but you also take care of critically ill patients and everything in between. So most common on-call procedures are going to be appendectomies for appendicitis, cholecystectomy, removing the gallbladder for gallstones and cholecystitis, but then also doing bigger open operations for things like small bowel obstruction, perforated colons, so those are the most common urgent cases, and then most common elective cases are going to be things like gallbladders, hernias, reflux surgery, skin and soft tissue masses. We have the full complement of minimally invasive approaches here. We have endoscopy, we have laparoscopy, and robotic surgery. And I'm excited about the fact that for being a mid-sized hospital, Baptist has 2 robots, which is a lot. I came from a 1,000-bed hospital that only had 2 robots. So for the fact that we have 2 is great. The plan of care and setting yourself and the patient up for success, that starts in pre-op, whether that's urgently in the emergency room or whether that's in the office discussing an elective procedure, not just explaining everything to the patient, making sure they understand, but also helping them make choices along with you. Is this going to be an open surgery? Is it going to be a minimally invasive surgery? Are we going to do an ostomy? Are we not? Depending on what the procedure is, there are some different options and different possibilities. And I think setting them up for success is making sure they're well educated, making sure that their opinions and their values are heard, and also setting them up with expectations. Because if they have appropriate expectations for each of those options, their post-op care and their recovery, both mental and physical, is going to be more successful. I'm very honest, I'm very direct, which can be, I think is a value, but some people might not always see it that way. But I hope that they always know that I have their best interest at heart and that I'm trying to be upfront and give them as much information upfront as possible.